Glipizide, Glucotrol, uses, side effects, and important safety information. What is glipizide? Glipizide, also known by the brand name Glucotrol, is an oral medication used to help control type 2 diabetes in adults. It belongs to a class of drugs called sulfonylureas, which work by stimulating the pancreas to release more insulin. This increase in insulin helps lower blood sugar levels and improves the body's ability to use glucose effectively. Glipizide is available in both immediate release and extended release forms, typically taken once or twice daily, depending on your healthcare provider's instructions. What is glipizide used for? Glipizide is prescribed to manage type 2 diabetes mellitus when diet and exercise alone are not enough to control blood sugar levels. It helps reduce long-term complications associated with uncontrolled diabetes, such as nerve damage, kidney problems, and vision loss. How glipizide works. As a sulfonylurea, glipizide works by prompting your pancreas to produce more insulin, which helps reduce blood glucose levels after meals and throughout the day. For glipizide to be effective, your body must still be capable of producing some insulin. Common side effects of glipizide, Glucotrol. Like all medications, glipizide can cause side effects. Most are mild and may lessen as your body adjusts to treatment. However, it's important to monitor how you feel and discuss any persistent issues with your healthcare provider. Commonly reported side effects include dizziness, 7%, diarrhea, 5%, nervousness, 4%, tremor, 4%, gas or bloating, 3%, low blood sugar levels, 3%. These side effects were reported by individuals taking glipizide ER, Glucotrol XL, in clinical studies. Other possible side effects include vomiting, constipation, heartburn, skin rash. Serious side effects and warnings. Seek immediate medical attention if you experience symptoms of dangerously low blood sugar, such as feeling extremely hungry, fast or irregular heartbeat, shakiness or anxiety, sweating or tingling sensations, dizziness or weakness, drowsiness, confusion, or fainting. Low blood sugar can be serious, especially if glipizide is taken without food. To reduce this risk, always take glipizide or Glucotrol with a meal, and never skip meals while using this medication. If you have kidney or liver problems, are elderly, or take other diabetes medications, speak with your healthcare provider before starting glipizide. Regular blood sugar monitoring and medical follow-ups are essential to ensure this medication is safe and effective for you. Glipizide dosage forms. Glipizide, also known under the brand name Glucotrol, is available in both immediate release and extended release oral tablets. These forms allow healthcare providers to tailor treatment according to each patient's blood sugar levels and daily routine. Common dosage forms and prices. The average cost for 90 tablets of 10 mg glipizide is approximately $13.38 with a GoodRx coupon, which is about 39.91% lower than the average retail price of $22.26. Typical dosing for glipizide. Glipizide immediate release, Glucotrol. The usual starting dose is 5 mg by mouth before breakfast. Your healthcare provider may increase the dose gradually every few days to achieve target blood sugar levels. If the total daily dose exceeds 15 mg, it is usually divided into 2 doses taken before meals. The maximum recommended daily dose is 40 mg. Glipizide extended release, Glucotrol XL. For the extended release form, the typical starting dose is 5 mg once daily, taken before breakfast. Your provider may increase the dose if needed. The maximum recommended dose is 20 mg once daily. Special considerations. Your dose may be lower if you are older, have liver impairment, or are taking other anti-diabetic medications. Always follow your healthcare provider's instructions and avoid adjusting your dose without medical advice. Glipizide contraindications. Certain conditions make glipizide unsafe to use. These are known as contraindications, situations where taking the medication can cause harm or increase health risks. You should not take glipizide, Glucotrol, if any of the following apply to you: allergy to sulfonamide medications or to glipizide itself. Type 1 diabetes, since this medication relies on your pancreas to produce insulin. Diabetic ketoacidosis, DKA, a serious condition caused by dangerously high blood sugar and acid buildup in the blood. If you have any of these conditions, or if you're unsure, speak with your healthcare provider before starting Glipizide. Pharmacist tips for Glipizide, Glucotrol. If you've been prescribed Glipizide, also known by its brand name Glucotrol, following the correct usage guidelines is essential for keeping your blood sugar stable and avoiding side effects. Here are important pharmacist-recommended tips to help you take Glipizide safely and effectively. 1. Always take Glipizide with food. Take Glipizide with a meal or about 30 minutes before eating. If you take Glipizide once daily, it's best to take it with breakfast or your largest meal of the day. If you skip a meal, you may also need to skip your dose of Glipizide. Taking Glipizide without food can lead to dangerously low blood sugar, hypoglycemia. Always confirm with your healthcare provider what to do if you miss or delay a meal. 2. Extended release tablets must be taken whole. If you are prescribed Glipizide extended release, Glucotrol XL, make sure to swallow the tablet whole. Do not crush, chew, or split the tablet. These tablets are specially designed to release the medication slowly over time. You may sometimes see what looks like a tablet in your stool. This is the empty, non-dissolvable shell that once held the medicine. It's normal and not a cause for concern. 3. Avoid alcohol while taking Glipizide. Avoid drinking alcohol, especially when starting treatment or when your provider adjusts your dose. Alcohol can amplify Glipizide's blood sugar-lowering effects, putting you at risk of severe hypoglycemia, a potentially dangerous condition. 4. Be cautious with activities that require focus. Glipizide can cause dizziness or lightheadedness in some people. Avoid driving, operating machinery, or performing tasks that require full concentration until you know how your body reacts to the medication. 5. Recognize and manage low blood sugar, hypoglycemia. Glipizide increases the risk of low blood sugar, especially if meals are skipped or delayed. Common symptoms include shakiness or trembling, nervousness or anxiety, sweating, hunger, weakness or dizziness. Always carry a source of fast-acting sugar with you, such as glucose tablets, hard candy, fruit juice, or regular soda. If your blood sugar drops between 50 to 70 mg/dl, follow the 15 to 15 rule. Consume 15 grams of fast-acting sugar. Wait 15 minutes, then recheck your blood sugar. Repeat the process if your levels haven't returned to a safe range. If your symptoms persist or worsen, call emergency services immediately. Taking Glipizide, Glucotrol, correctly is key to managing type 2 diabetes safely. Always take it with food, avoid alcohol, and stay alert to symptoms of low blood sugar. Regular monitoring, communication with your healthcare provider, and understanding how your medication works are essential steps to protect your health. If you found this video helpful, please subscribe to HeInfo, your trusted source for science-backed health information explained by professionals. Turn on notifications so you never miss an update on essential health topics and medications like Glipizide, Glucotrol.